Hi everyone, welcome to Doc Dynasty. This is Dr. Raval, where we talk about all things healthcare. And I am a board certified physician for over 36 years. So let's talk about healthcare transparency. We've heard these words thrown around. There is an executive order that's just been signed on healthcare transparency. So what this does is it allows consumers to know the price of what a billing code costs. So when a service is provided, this is what that service provider is getting paid. It was aimed to help consumers, which it will, but more importantly, it forces healthcare providers and insurers, more importantly, to stop cutting private deals unless you're going to tell the consumer exactly how much a service costs. So if you're charging the consumer directly, a consumer needs to know whether you're going to pay or are going to charge them $12,000 for this surgery versus $3,000 at another provider's place. So there's been a lot of pushback from health insurance companies and hospitals because they say that they no longer can cut private deals. Exactly. That's why we need this. So on the bottom end of that totem pole is the private practitioner because they don't work with a huge group. So normally you get paid what you get paid. You don't get to bargain better prices. Going up from that, a multi-specialty group or larger single specialty groups may be able to negotiate different prices. Out of all of these groups, though, hospitals, because of just the volume of people they see, have traditionally gotten better prices. That doesn't mean that those better prices are passed down to the consumer. So this Healthcare Transparency Act is there so that everyone across the board, consumers, providers, large group delivering healthcare knows what they're going to be reimbursed. The consumer knows what they're going to be charged and can shop around. And this, by the way, also has to do with drug prices. There is drug price transparency built into this act as well, this order. So I think that it's exciting. I think it's hopefully going to be reinforced. Several years of these types of orders and acts have been put forward but not reinforced. So that's what healthcare transparency is. It is for everybody. It is for the provider of service. It is for the consumer, and it allows people to shop for their services just like we shop for our doctors and we shop for our hospitals. So good news, and that's basically in a nutshell what healthcare transparency should produce. Hope that's helpful.